Natalie Goodnow actually just did a paper, I think I mentioned quickly in my intro, for the Heritage Foundation on the faith-based world and adoption and foster care, for which we're grateful. Thank you for being here.
Oh, thank you. It's an honor to be here and to participate in this event. I was really glad to hear that National Review was putting this on. So I'm going to cover a few different things. I'll try and get through it all quickly. So, as Charmaine already mentioned, there are almost 500,000 children in foster care in the United States today. To put that into perspective, that is roughly the population of Miami. Now, some of these kids will stay in care a few weeks or a few months, and some of them will spend the rest of their childhood there. Some will be reunited with their parents, some will be adopted or taken in by relatives, and some, about 20,000, will age out of the system on their own with very little support. So, again, as Charmaine already talked about, from 2012 to 2016, there was a 10% increase in the number of kids in foster care. And some states actually saw increases greater than 50% during that time. States like Minnesota, Mississippi, and New Hampshire, to name just a few. And during that same time, almost half the states in America saw an increase of 25% or more of children waiting to be adopted. So as we're thinking about what's driving this increase, one of the factors is, of course, the opioid crisis. In 2016, 1 in 3 cases of children removed from their homes involved caretaker drug abuse. And in Wisconsin, which is where I currently am, from 2011 to 2016, the number of kids removed from their home because of parental drug abuse increased 120% in just a few years. It's kind of crazy. And so my colleague and I started looking into this because a lot of people had said that opioid and foster care were connected, and so we dug a little deeper, and indeed that was the case. And we found that there's a very strong relationship between opioid abuse and the number of kids in care. We were looking at things like prescription rates and opioid-related hospitalizations. Now, as a lot of people don't know, but was mentioned, infants less than a year old made up 18% of entries into foster care in 2016. They are by far the most represented age group. And more babies are entering care now than we have seen in decades. And a lot of these babies have neonatal abstinence syndrome. So one of their first experiences after birth is going through terrible withdrawal. Now, again, our research looked at the increase in neonatal abstinence syndrome rates and the share of kids age 0 to 1 entering care. And again, there's a significant relationship. So as these rates are rising, more and more babies are entering foster care. So you might be wondering, who's taking care of all these kids if we're getting this influx of kids into the system? And unfortunately, from the limited data available, foster care capacity is actually going down in many, if not most, states. So this means either the number of foster homes is decreasing, or that it's staying the same or increasing, but not fast enough to keep up with the increase of kids in care. And as you might imagine, this adds considerable stress to already burdened child welfare systems. Now, for decades, people of faith and faith-based organizations have played an incredibly important role in foster care and adoption. And in fact, they were a foundational part of the child welfare system, predating even the government system that we see today. So their role has been tremendous. Research has found that practicing Christians may be over twice as likely to adopt compared to the general population, 50% more likely to become a foster parent, and almost 3 times as likely to consider becoming a foster parent. So we just need one of those nudges. Just to give a little taste of some of the great work that is being done, one Christian organization named The Call has helped recruit almost half the foster families in Arkansas. Catholic Charities, which I'm sure many of you are familiar with, served about 10,500 children through foster care and adoption services. in just 2016. And of course, these are just a handful of many examples out there. But I think that there is tremendous potential for the faith community to do even more. I think we haven't fully tapped into what this community is capable of. As we think about kind of moving forward and addressing the situation, there is change happening right now, both at the state and national level. You can think of something like the passage of the Family First Act, which gives states the opportunities to receive more preventative funding to help kids stay in their homes. It helps encourage kids being placed in foster homes rather than in group homes. And at the state level, there's, I can't sum it up all up here, but to give you a taste, this past spring, Wisconsin passed a package of bills, 11 of them, seeking to reform the child welfare system. Arizona passed legislation seeking to ensure that infants that enter care because they were exposed to drugs in the womb will have permanent homes faster and not languish in care. And states like Kentucky and Georgia have